Today we're going to be tackling a very difficult and challenging topic on mold detoxification. Now before we dive into the specifics, I want to clear some definitions. This is a topic where a lot of people get confused. So let's lay out some definitions before we talk specifically about detox. If you look at this diagram, you can see here allergy versus colonization versus toxins. It's important to understand these differences when we're talking about detox. So we're going to lay these out for you so that you're not confused on the issue. So first, let's dive into mold allergy. Now, if you've ever had an allergy environmentally, like a ragweed allergy, dust, pollen, dander, that type of thing, this is what we're really talking about, an IgE allergy response. So if you've ever been to an allergist and had a skin prick test done or had a blood test done measuring IgE antibodies to different things, this is what we're referring to. Now, research shows that at least 22% of the general population is allergic to at least one type of mold. Common symptoms for allergy include itchiness, irritated eyes, coughing, sneezing, asthmatic breathing, and hives. We know that nutrients can be very helpful if you are exposed to mold in your general environment. And so some of those nutrients are helpful for the control of what's known as mast cell destabilization. Mast cells release histamine. So when we look at these symptom associations, it's as a result typically of histamine production, histamine release. Your white blood cells will release this chemical compound, and that's what's responsible for creating these symptoms. These types of white blood cells, oftentimes referred to as mast cells. So if you've heard of mast cell activation, a lot of people talk about mast cell activation in context with mold. What we're after here is either a reduction in histamine, so we want to lower it, or we want to stop it from being released in large amounts. And so there are a few things nutritionally that can be done in that regard. So for mast cell stabilization, nutrients that are probably the most helpful, the biggest one is probably quercetin. And if you combine that with vitamin C, it has a synergistic effect, stabilizing the membrane around these mast cells, reducing the quantity of histamine being released. Now, there are other things that can be added to this. We could put bromelain on this list. We could put nettle. We could also put NAC or N-acetylcysteine. These all work together synergistically to do that. So that's one strategy if you're just trying to support yourself nutritionally from the allergic response of mold if you're outside and it's a high moldy day, that kind of thing. And then we can also break down histamine, and there's a specialized enzyme called DAO, diamine oxidase, that helps to support histamine breakdown. Now this enzyme, your body can produce it, but many of you, because you're in mold damages your ability to make this enzyme, and so you're at a loss, right? You're more reactive, having more allergy type symptoms because mold toxicity has damaged your body's ability to adequately produce DAO. Now you need things like zinc and vitamin B6 in there. So nutritionally, making sure you have adequate quantities of that nutrient pair, but also you want to get to the bottom of why your body's not breaking it down ultimately, which in many cases is mold exposure. So mold allergy is not the same thing as mold toxin exposure. They happen together, but they're two very different mechanisms. And so the allergy itself requires no detoxification. And I think this is where a lot of people get confused. If you're allergic to a mold, the way that you reduce your exposure or reduce your symptoms is you minimize your exposure to those molds. And so for a lot of people, this one, if you don't live in a moldy home or you don't have a moldy workplace or vehicle, then it's just going to be seasonal for the most part, just like many other allergies. So you don't need to detox from this, but you can take these nutrients as support agents to help your body deal with the consequence of an increase in histamine, which causes many of the allergy type symptoms. So again, no need to detox from mold allergy. just supporting it is enough. So I think that's an important differentiation. Now, next we have something called mold colonization. Now, there are a number of terms that we can use here. One of those terms, medical textbooks you'll find is a term called mycosis, which typically refers to mold infection. This is where mold starts to grow on the body or in the body. So infection, sometimes you'll also hear the word overgrowth. Mold overgrowth, mold infection, mycosis, or mold colonization. They all basically fall within the same family. And when you have mold growing on you or in you, there are different examples of this. So if you can see here, examples include a candida overgrowth in the gut, which is a very common consequence of people being exposed chronically to mold. And then more dangerously and more rare would be aspergillosis, which is where mold spores, where you breathe them in from the environment, they colonize in your lungs. This can kill you. This has a approximately 50 to 60% mortality rate when people get it. But these are just examples. There are lots of examples. I'll show you some more examples here in just a minute of mold growing on or in the body. Now, immunosuppression caused by chronic exposure to mycotoxins, which are the toxins that molds produce. The VOCs, also molds produce VOCs, volatile organic compounds. Hyphal fragments, which are like bits of mold pieces, and then dead mold cells. So these are all, if we classify or lump all these things together, this is really what we would clump together and call the toxins from mold, right? Mycotoxins, VOCs, hyphal fragments, and dead mold cells. Now, these things contribute to immunosuppression. Immunosuppression increases the risk of colonization. So when your immune system's not capable of behaving in a strong manner, it's not going to fight mold from colonizing on your body as effectively, and so you're at greater risk for this to happen. We also know, as an example here, mycotoxins specifically are antibiotics. Antibiotics, I mean, this is what penicillin is. If you've ever taken the antibiotic penicillin, it's a mold toxin. It's derived from the mold Penicillium. And so these antibiotic properties of mycotoxins will deplete the microbiome, which is your healthy flora in your GI tract. So in essence, it's acting like an antibiotic, and it's one of the biggest things that leads to candida and other types of yeast overgrowing in your gut, because we all have candida in our GI tracts. It's a normal inhabitant of the gut, but it's usually kept in check and kept balanced by healthy microflora or bacteria. But when you're exposed to tremendous amounts of mycotoxins that act as antibiotics on your microbiome, that becomes depleted, and so now the natural candida that's already in your gut starts growing out of control. And when that happens, candida starts generating its own toxins. So one of the toxins we know candida can produce is a mold toxin called gliotoxin. But candida can also do other things. It can also cause a mimicry of gluten. So if you're gluten sensitive, the hyphal wall fragments or proteins on the surface of candida can actually mimic gluten. We also know that candida can ferment your food. So it can turn your carbohydrates in your diet into alcohol, and that alcohol has, secondary consequences on the liver and on your nutritional status and on the integrity of the gut lining. So you don't want overgrowth of these yeast inside your GI tract, and this is a secondary consequence of mycotoxins poisoning your good bacteria, allowing this to grow out of control. So we know that immune depletion caused by chronic inflammation. So when you're in a moldy environment, you're basically, there's a term, many of you have heard this term called SIRS, chronic inflammatory response syndrome. That was coined by Dr. Richie Shoemaker years ago to describe biotoxin illness. Biotoxins are toxins produced by molds and other bacteria. But chronic inflammatory response, so your body becomes chronically inflamed, that weakens your immune system as well. And so it sets the stage, right? Your immune system's distracted. It's so busy attacking the toxins that it's being exposed to from the environment that it's not basically it's not capable of defending itself efficiently against mold from colonizing the body. And so you get colonization. And so this typically occurs on the skin, in the sinus cavities, in the oral cavity, in the GI tract, as well as in the lungs. And sometimes the colonization is your own flora, meaning, as an example, candida. We all have some candida, but sometimes, it gets out of control and now it becomes problematic. But sometimes the colonization is from the mold in the external environment. So the example there would be aspergillosis, the aspergillus molds in the environment. Now, these are some images or pictures of what mold colonization can look like. So we'll blow in on this. You can see this was actually somebody who came to see me. It was a young child, and they were in mold, and they had a severity of yeast growing in the oral cavity, as you can see here on the tongue itself. And you can see here even on the tip. So you've got mucus back here, and then you've got yeast growing actually on the tongue directly. This is another example of somebody I saw. This was a patient with rheumatoid arthritis, and part of what was driving their rheumatoid arthritis was mold exposure, environmental mold exposure. They lived in a moldy home, and what was happening to them is mold was also starting to colonize underneath the nail bed. So this is the hand, and this is the toes, obviously, but you can see the yellow discoloration and the white and the tips. This is mold colonization of somebody who's immunocompromised because they're in a moldy environment. Now, I've got some more pictures here. This was actually taken out of the journal Fungi, and some really good pictures of examples. And I just wanted to give you kind of a more diverse array of examples of what mold can look like on the skin. And these are different types. You can pause it here, but know that the types of mold infections are listed above in this description. And then each one of these images is labeled A through H, so that you can see the different varieties of mold that can grow on the skin and some of the examples of presentations of what they actually look like. So sometimes it's easy, right? You can see the mold growing, and sometimes it's not so easy. Like aspergillosis, if mold starts to grow in the lung, you're going to have shortness of breath. You might have some wheezing, or generalized breathing dysfunction. But sometimes it's a slow, chronic creep. It's not like an acute infection where you start running a fever and you need to go to the hospital right away. So sometimes the infection itself or the colonization is not super obvious, and I think it's important to understand that, because if you've been in mold for a long period of time and you're at home maybe watching this and thinking, how do I detox? I'm watching this show so I can learn how to detox. I think one of the areas where people fail detoxification is because they're colonized with mold, because they were immunosuppressed being in it. And so they try a detox protocol, or they get on a detox protocol, and it's not working. And it's because when you're colonized, when you have colonies of mold inside of you, one of the things they're going to do is they're going to produce mycotoxins. And if you're trying to detox these, you're not going to win, because you're maybe taking binders or doing other things to enhance your detoxification pathways. But here you have these colonies that are growing inside of you. So you have your own little mold toxin factory just spewing out toxins. And so the reason why many become unsuccessful is because they don't actually know that they're colonized with mold or yeast. And so they're just struggling to get better. So understand that colonization, if you have it and don't know it, this is something you want to work with a doctor to test for, so that you can determine it and deal with it, right? Because if you're mold colonized, it will require detoxification, but detox happens after treatment of the colonization. So you have to, step one is you have to deal with the colonies that are growing on you or in you before you can begin detoxification. The next step in that would be detox. So you have to do it in the right order, or you'll fail, become very frustrated, become very symptomatic. And that's why I'm parsing out these differences, because if you don't know this, you're going to be a miserable person trying to detox yourself. Hey, if you want to see the full show, the full breakdown on mold detoxification, check out my comprehensive crash course right here.